Case number 4. A 5-year-old child with sickle cell disease is brought to the clinic with a high fever. Given the patient's background, they are at increased risk for infection with what type of organisms? A. Viral infections like influenza. B. Fungal infections like candidiasis. C. Bacterial infections with encapsulated organisms. C. Parasitic infections like malaria. Correct answer, C. Children with sickle cell disease are particularly susceptible to infections from encapsulated bacteria due to impaired splenic function or functional asplenia. The spleen plays a crucial role in filtering bacteria and mounting an immune response, especially against encapsulated organisms like Streptococcus pneumoniae and Haemophilus influenzae. In sickle cell disease, repeated splenic infarction leads to loss of splenic function, increasing the risk of severe infections from these organisms. This vulnerability necessitates prophylactic antibiotics and vaccinations against these bacteria in children with sickle cell disease.